but I haven't really seen our representation change. There hasn't been any strong or actually really any Democrat running in several cycles for this House seat. And, with my background in medicine and now I actually work in cancer research advocacy, I came to a point where, you're sort of done fighting bad policy and you're really ready to have a seat at the table to help inform good policy. And knowing that healthcare is one of the major issues that is in our nation, I felt that I had a skill set really to offer at that table of policy creation. And I honestly think my background is essentially problem solving. I mean, that's really what that's really what a legislator should be doing, listening to people's problems and concerns and issues and being able to work on a sort of a nonpartisan team, look at the facts and diagnose the problem and really implement a real life solution. So that's what led me to the decision to run. And what I'm thrilled with is the reception I've had throughout the district, with people really looking for somebody who's going to have concrete solutions for the problems that they and their families are dealing with. And they don't come from this deeply divided political background.
You have recently put out an animation where you talk about what you'd like to see implemented in healthcare to help with the cost and to help with making it the case that more people can be covered by healthcare. Can you talk a little bit about what the details of that plan would look like?
Sure, yeah. I'd be thrilled to. I'm very excited about finally getting this out. I've had a very clear vision of where I see our healthcare system going, and I really know that it's a goal we can achieve, this idea of universal coverage, which means that every single American has access to quality, affordable healthcare. And I think where most folks get sort of thrown is by the idea of how do we pay for it. You hear all these terms thrown out of single payer, Medicare for all these kinds of things, which people don't distinguish the difference and they sort of throw it all in one bucket. And my plan really has a very detailed and distinct structure to it. So basically what it does is it provides a sort of a very robust public option of a Medicare buy-in, which we never really had. That was one of the intentions with the ACA initially, and that got scrapped for, various reasons we won't get into right now. But it's really important that we have that public option because we know that Medicare, for the most part, is very efficient and effective. And this is something that will enhance, ultimately, consumer choice, because when you are forcing private insurance players to compete in the marketplace with a public option, it's going to drive down costs, which, as you know, is one of our biggest issues. It's going to enhance competition and choice for the consumer. And it's going to end up delivering the best product for each individual consumer and family, which is really our ultimate goal, is to make sure that every single American has quality, affordable health care.
Great. And we'll put it's a really fun animation too and easy to understand. So I'm going to put the link to that in our show notes as well so people can see it.
Great. Yeah, I'd appreciate that. Thank you.
Can you talk a little bit about the kinds of issues you saw in your district when you were working in the ER and the kinds of things that Congress could be tackling to help solve some of those problems?
Yeah, that's a great question. The emergency department is an interesting cross-section of all of society. You have folks who come in there sometimes for just strictly a medical concern. Obviously, we have the ends of the spectrum with that, with extreme, horrific trauma and violent, devastating injuries and things like that. And then we also have patients who come in with essentially very limited medical issues, but they have maybe issues related to mental health or access to resources, homelessness, dealing with drug addiction, poverty, the whole gamut of social issues that really, impacts our society. And the emergency department is in many ways the place that a lot of those folks come to when they have nowhere else to go. So I think that certainly has given me a unique perspective to understand the confluence of issues that our district and our county and our state really deal with. And that's not by any means unique probably to our state in many ways. We obviously have issues of drug addiction. Now we know opioid crisis is the fastest growing addiction that is becoming an epidemic that impacts folks from all ends of the socioeconomic spectrum. And that's not something new, quite honestly. That's something we've seen for decades in the emergency department. It's just something now that I really think is spreading to other demographics. And that's why it's managed to capture more of the headlines, because it does really impact a larger number of people. And gun violence is another thing. I've seen my share of devastating gun violence in the emergency department, as have most emergency physicians. And we have a very vested stake in making sure that we use evidence-based research to drive good, effective policy. Because it's important to know, for example, what populations are most vulnerable. What is the epidemiology of the most common gun-related injuries and deaths? What is the specific kind of firearm related to the various injuries and mortality statistics? All of that data, the impact of substance abuse, the impact of history of mental illness, the age variations, the various demographic backgrounds, all of that really helps to drive better policy. So I think it is imperative, and I was glad to hear last week that the Congress did elect to repeal, or at least I think kind of reword that Dickey Amendment so that now research can be done at the CDC to really investigate gun violence, because we need data, we need research, we need facts, and that is the best way to guide our policies, is to know what has made a difference, what makes an impact, what has not worked in the past, and then guide our policies from there. And that is no different for gun violence than it is for the opioid crisis, than it is for healthcare reform and access to health insurance. Honestly, it's the same thing for education policy and so many other things. So that is what I'm a huge proponent of. And I think with a background in emergency medicine and in medicine in general and science, that has taught me the importance of evidence-based research and the critical role it plays in developing really good policy.
You mentioned CDC research and the importance in gun violence. Could you also talk, you've been working more recently in doing cancer research. How important are government agencies and grant funding in research into things like cancer?
It's incredibly imperative. It's pivotal. We are making significant strides in various areas of cancer research, both at understanding the factors that go into play in causation or in the occurrence of various cancers, but also in the area of therapeutics and looking at the role of our own immune systems and our genetic makeup and what those factors contribute to more effective therapies. We're eventually going down a pathway to very personalized therapies in cancer treatment, which is incredibly exciting and gives us great hope for those folks who are struggling with so many various forms of the disease. And research is the cornerstone of that progress. And so it's important that we do not cut funding at the NIH and various other sources of grant money. That is something that I think should have no partisan influence. I mean, cancer does not choose. It really doesn't care whether you're Republican or Democrat, black or white, Jewish or Hindu or Christian. It hits all populations. And that is something that I think every American can get behind, is making sure that we invest in the research that is going to help all Americans in being able to better diagnose cancers, being better able to catch them early, and being much more effective at treating them and improving the quality of life of people as they go through treatment.
Well, I know that you have a busy schedule as you're running for a special election that's coming up in less than a month on April 24th. Are there any other issues that you're especially concerned with or want to make sure that our listeners think about?
I would just emphasize the fact that, I'm also a very big proponent of education. And to me, education is sort of the common link for so many of our issues in this country. Whether it's the general health and well-being of Americans and understanding, risk factors and things like that, whether it's related to substance abuse and things like the opioid crisis, whether it's related to general issues of poverty and access to resources and employment opportunities. I just think education is really the common link, and a lot of times it gets lost in the conversation of some of the other things that take up the bigger headlines. But it is something that we have to be perpetually mindful of how we invest in our education system in this country and make sure that we are giving our young people that great first start in life and really arming them with knowledge and information so that they can pursue not just their goals and dreams in their occupations and professionally, but so that they can live healthy lives and really understand the things that they may be vulnerable to and be able to have the greatest opportunity to be productive, happy, healthy members of our society. And education is something that is obviously an area we struggle with in Arizona, as you probably know. And right now our public education system is a bit under attack because of this whole discussion of vouchers and privatization, which takes money out of our public schools. And I just cannot emphasize enough how important that is. And it was so important to me and my upbringing and what got me here of quality public schools. And that is where the vast majority of kids in our country go for their education. And it really is the key to so much else in life. And I think it's really critical that folks who are running for office in all corners of our country are committed to keeping our public school system strong and making sure that every child, regardless of zip code or their parents' salary, receives that great first start in life that I was fortunate to receive through the public schools in Ohio. So that's one other piece that I want to make sure I emphasize. And obviously, being a physician and from a science background, I feel that is something that is always the key to general wellness and good health as well.
Well, as a fellow product of Ohio Public Schools, I agree with you wholeheartedly.
Oh, great. Where did you grow up?
I grew up near Canton.
Okay, great. Well, I went to school outside of that area at Northeastern Ohio Medical University and actually did some of my medical school rotations at Akron Hospital, which is, close to Canton.
Yeah, not too far from where I grew up.
Yeah, well, that's great. So, yeah, those are just the things that I'm eager and ready to fight for. I think are really at the heart of, what a lot of families in our country need us to go to D.C. and really be their voice for. So I'm excited to have that opportunity.
Excellent. Well, thank you so much for talking with me. We will put links on our website up to your website and your Facebook and your Twitter and that animation that just came out. That's so great.
Well, fantastic.
Great. And I'll be reading for you on April 24th. I've written a bunch of postcards, so.
Oh, well, thank you, Kelly. I appreciate that. And thank you so much for giving me this opportunity again to just speak on the few issues that we were able to touch on. I think it's great that you guys do this podcast. I really appreciate the opportunity to speak with you.
Hello, everyone. This is Kelly with Two Broads Talking Politics. In this segment, I am here with Dr. Eady Mann, who is running for Congress in Texas in the 31st District. Hello.
Hi, how are you?
Great. Thanks so much for coming on.
Yes, anytime.
To start, could you tell us just a little bit about your background and why you're running for Congress?
Yeah, I am a family practice doctor in Cedar Park, Texas, and I have been in Central Texas and practicing for about 20 years. I have been engaged in community activism for that time. Started pretty much right after I moved here with some community activism projects, and politically active with Democratic Party at the local level, the state level, the national level for about 10 years. So running for office is something that has been a consideration of mine for a while, and this seemed like the time to do it. And I am motivated by the things that I see in practice, the things that I see going on in the national government with the current administration, and I'm really excited to be doing it.
And where exactly is District 31?
It is composed of Williamson County and Bell County, which is Central Texas, and we are the counties north of Austin.
You said one of the things that motivates you to run for Congress is the kinds of things you see in your practice. Could you talk a little bit about what that means, what sorts of issues you're seeing, and how those things are affected by the decisions that Congress makes?
Yeah, I've got a lot of examples. In fact, I've started talking about my 10,000 reasons for running for Congress, and it's the stories that I've heard from the 10,000 patients that I've heard that I've served over the last 20 years. I can give you just a couple of quick examples, and I could talk about this all day, but the ones that come to mind are things like the two mothers in my practice who have lost their children to gun violence. So all the issues going on with gun violence I've seen firsthand in my practice. I've seen what these families go through when they lose their children this way, and it very much informs my opinions and the things that I think that we need to do differently from a congressional level to protect other families from losing their children in such an awful way. Obviously, healthcare is another issue that is big. I've got a 5-year-old little girl who was diagnosed with leukemia when she was 4, and she had to go through months of chemotherapy. She lost her hair. Her face was swollen. And now with what Congress is doing, her ability to get health insurance for the rest of her life is at risk because if the current Congress has their way and if the GOP has their way, pre-existing conditions are going to come back, and this little girl will face the prospect of not having coverage for her health care for the rest of her life. Right after the election, I had a lesbian couple come in, people I've been caring for a while, and they said, well, we're going to really hurry and get married right away because we're worried that our right to